Paecilomyces, a closely related taxon to genus Penicillium, is a relatively rare fungal infection which typically causes ocular and cutaneous infections in immunocompromised patients. Classic radiographic findings include pleural effusion, single lung consolidation, and cavitary pulmonary disease. An 83-year-old male with hypertension presented with worsening dyspnea, lower extremity edema, chest pain, and a productive cough with clear sputum for 2 weeks with an associated 35-pound weight loss. He recovered from a respiratory tract infection in Mexico 3 months prior to presentation. He denied smoking in the past. On admission, the patient had an elevated blood pressure and oxygen saturation of 100% on room air. A physical examination was notable for labored respiration with decreased breath sounds on auscultation of the left lung. An initial chest x-ray revealed complete opacification of the left hemithorax with severe mediastinal shift, likely due to pleural effusion. The patient was subsequently started on an intravenous piperacillin tazobactam for suspected empyema. A computed tomography angiography of the chest confirmed these findings, for which a chest tube was placed and drained dark-colored fluid. The pleural fluid cytology was negative for malignancy and exudative per Light's criteria. An autoimmune and infectious workup was negative for complement levels, anti-SCL70 antibody, anti-CCP antibody, adenosine deaminase, anti-neutrophil cytoplasmic antibodies, anti-DNase B, coccidioides, histoplasma, acid-fast bacillus staining of the sputum. The ANA antibody was positive with a titer of 1 out of 640. The blood, pleural fluid, sputum, and urine cultures were negative. Bronchoscopy revealed abnormal left lower lobe mucosa and chronic inflammation with reactionary changes. The bronchoalveolar lavage cultures grew paecilomyces species, for which he was started on voriconazole. Paecilomyces is a hyaline hypomycete typically found in soil, decaying plants, food products, and air, resulting in devastating ocular, cutaneous, subcutaneous infections in immunocompromised patients. It is known to be a contaminant of sterile solutions and resistant to most commercial sterilization techniques. Paecilomyces varioti and Paecilomyces lilicus are the two most encountered species causing human disease. Paecilomyces are classically diagnosed by fungal culture, with different species having different susceptibilities to antifungal agents. A literature review showed that the route of infection in immunocompetent patients is through foreign bodies or implanted devices, including prosthetic heart valves, dialysis catheters, and intraocular lens implants. Only a few reported cases pose similarities to our immunocompetent patients, who are all treated with amphotericin B and posaconazole. Azole antifungals such as voriconazole and posaconazole are preferred due to their activity against Paecilomyces infections compared to other antifungals. In recent times, certain species of Paecilomyces are more commonly seen in immunocompetent patients, have conferred resistance to azole antifungals. Voriconazole has fungicidal activity against P. lilicus in contrast to the fungus-datic effect of amphotericin B and itraconazole. In contrast, P. varioti is universally susceptible, both in vitro and in vivo, to amphotericin B, and it is therefore the agent of choice. These are our following references, and attached I have some pictures of Paecilomyces on culture. Thank you.